I'm Dr. Kylene Krause. I'm a psychologist at Holland Hospital Behavioral Health, and I'll be talking about reducing anxiety. Anxiety can come from a variety of places, things at work, other kind of performance expectations, relationship difficulties, financial stress, and unpredictability of the future is a lot of the things I hear about from people. There are a number of physical symptoms that can come up as a result of anxiety, so things like headaches, digestive issues, stomach aches, diarrhea. It can also lead to more long-term things like high blood pressure, heart disease. It can impair our immune system functioning or make us more likely to, gain weight, sleep difficulties, and then some of those things kind of trickle down to other physical health symptoms. Sometimes it can be hard to tell about, what's a normal level of anxiety, because normal levels of anxiety is usually helpful. I know that sounds funny to a lot of people, but it helps us identify if something doesn't look right or it's out of place. It can help us be ready to react to a situation and helps us kind of hone our attention and help us perform our best. So if it's that level of anxiety where you feel like it's helpful in your everyday activities or it goes away quickly when that stressor kind of leaves, then you're probably experiencing a normal level of anxiety. If it's one that is impairing your functioning, causing you to avoid maybe things that you'd normally feel like doing or want to do, or impair your functioning and performing the way you used to be able to or you think you could, or it lasts longer than the perceived danger or out of proportion with the perceived danger, when it starts to not feel good is probably the point where it's excessive and time to do something about it. Deep breathing and meditation or mindfulness is some of my favorite techniques for just getting your body to relax. Just in general, breathing in through your nose kind of for a long time, kind of holding it there for a minute, and then breathing out through their mouth, kind of thinking about the stress leaving their body in that moment can be helpful. Sometimes doing visualizations or imagining you're at a very relaxing place out in the woods, on a beach, things like that. But sometimes just taking a bath or going for a walk and kind of distracting yourself can be really helpful for quick ideas to treat that anxiety. Staying extra organized can be helpful for some women. Sitting down on the weekends, maybe when there's more time, and making a menu plan for the week, making sure you have all the ingredients for meals. Maybe asking some of the other family members, delegating some of the tasks. Have some of your kids, even small children, often love to help with tasks and chores around the house, and maybe chopping up some vegetables or, asking some family members to get started on some of the tasks that they can help with. Those kinds of things can be helpful. Sometimes letting things go that aren't done perfectly. Some self-compassion can be some good tips for kind of maintaining that work-life balance. People should seek professional help when the anxiety is kind of out of proportion with the event or is kind of interfering with their everyday activities. When they have trouble kind of controlling it or feel like it lasts too long, that can be a good sign that it's time to come in and seek additional help. So when you see somebody for anxiety, they'll usually do a full evaluation. There's multiple different kinds of anxiety, so they'll see which kind you're struggling with, where the anxiety is coming from for you, and kind of make an individual plan based on your goals. That may or may not include medication, but often will include a variety of exercises or tools to figure out where you're getting stuck and to help you get through those difficult moments. Anxiety is one of the most commonly diagnosed mental health issues in the United States, and about 30% of U.S. adults will experience diagnosable level of anxiety at some point in their life. Usually it's pretty mild, and a lot of times people don't seek treatment. Only about 35% of people will seek treatment for anxiety, even though it's a very highly treatable. So I guess in that way, if you're dealing with anxiety, the good news is that it's highly treatable and not something that you should, just sit and suffer with long term.